The seventh building block of a health system is that the people must take initiative in providing proficient and efficient health services and funding special care facilities. These are the submissions of medical personnel and professionals at the first stakeholders forum of the Federal Teaching Hospital, Ido Ekiti. Ayomedia JB has details.
Despite paucity of funds, limited facilities, defunct buildings, and the increase in admitted COVID-19 patients, the quality of services at the Federal Teaching Hospital Ido Ekiti is highly unprecedented. To ensure optimum service, a nursing non-governmental contribution for healthcare financing was the focus of the stakeholders forum.
In this country, medical equipment are very expensive since most of them are imported. This is more so in Nigeria, where the naira has nosedived.
Government is stretched out of its element in trying to manage something as complex as well as personal as healthcare. Collaborations must remain bottomed up to ensure the delivery of efficient, effective, and equitable services.
The major problem facing the health sector, aside the resident doctor strike and apparent relocation of medical personnel abroad, is a lack of economic plan and limited resources from federal government, which medical experts say must be addressed to avert a total breakdown.
Nigeria's economic challenges, inefficient health planning and financing delays the country's progress towards attainment of universal health coverage.
It is very critical nowadays, more so that the resources that the federal government is giving its states and given its federal institutions are no longer enough.
Healthcare financing all over the world is an humongous task. It's neither cheap or free. Privileged persons must take the initiative to collaborate with medical facilities such as the Federal Teaching Hospital Ido Ekiti to realize their goals of saving lives.
It is true that we have funding gaps. I think what we need to do now is to begin to change the way we think about funding healthcare. People need to take responsibility for their healthcare. We need to harness both the public and private investment.
Together we can all do it. We cannot leave it to government alone.
It is agreed that Nigeria is still miles apart with the Western world on medical facilities. But that gap might just be reduced to its barest minimum if there is a public-private partnership. Ayomedia JB, TVC News, Ido Ekiti.